Hey everyone, welcome to the podcast, Bone Bootcamp with Sarah Purcell. I'm your host, Sarah. This podcast, my newsletter, and all of my programs are designed to help women approach aging with confidence and courage. I'm specifically focused on bone growth promotion and skeleton-safe movements in Bone Bootcamp, the course, and Short and Sweet with Sarah, the membership. In this podcast, I strive to bring you all the most current information on living your best life as you age. Let's get on with today's episode. Hi, and welcome to today's podcast with Melissa MacDonald, Dr. Mac. Melissa is a graduate of the Northwestern Health Systems University, and that is where she earned her Doctor of Chiropractic. She also spent time in specialty training, which I think sounds fascinating, at the Human Performance Center. And she did a lot of research and also honed her clinical skills there. She also has been a team chiropractor for a number of professional teams, and she can tell us about that. She has many international certifications. She's a faculty member at her university. And interestingly, she teaches emergency procedures, which I'm fascinated by. I have no idea what it is. I think I want to find out. But I will move straight into letting Melissa take over and tell you a little bit more about herself.
Yeah, so I've done a lot of different things. I'm still probably in the spectrum of chiropractors, green and new, since I graduated in 2015, but I have done my due diligence to make sure I can take care of my people. And no matter where they are on their, what I call their athletic journey or their athlete journey, whether that's actually going out on a field or simply getting in the backyard and playing with the grandkids, you are an athlete to me.
That is awesome. And when you talked about due diligence, I think it makes it a really good time for me to bring up the fact that although you're relatively new, for most of us are somewhat towards seniors in the audience, like myself, turning 63 this year, you have had experience that has caused you to educate yourself more. And it might be surprising that at your youthful experience, so to speak, you actually know a little bit more about osteoporosis maybe than some people. And I thought if you could share the story you told me, it might really help.
Absolutely. Yeah. I had a very traumatic experience about having to educate myself on chiropractic and osteoporosis or osteopenia, depending upon where on the spectrum you fall. And that was my first year in private practice. Basically, after I graduated, after I completed my fellowship, I went out into the real world and I started seeing real people. And, you know, you're a different animal when you're in the real world. And I had this patient come in. They were having mid-upper back pain and we were working through it and it was going really well. And I was manually adjusting them. And I was using actually a technique where they were laying on their back. And it was about their 5th or 6th visit. And I adjusted them and it felt like I broke the underwire of their bra. And I was like, oh my goodness, I think I just broke your bra. And they were like, I'm wearing a sports bra. I don't have an underwire. And immediately I knew at that point, oh my God, I broke this person's rib. And they were like, actually, I think you broke my rib. I probably should have told you earlier this week I had a DEXA and I got diagnosed with osteoporosis.
Oops.
Like, yes, the answer is yes. You should have told me because I would have done something different. I wouldn't have used that technique on someone that had a decreased bone density because of the risk of fracture. It's one of the reasons why when you go to a chiropractic office in your first visit, you're given a consent. Well, let me rephrase that. You should be given a consent form and explained all the possible risks that could happen. And one of them is fracture, typically due to low bone density or some other pathology or disease of the bone that can lead us to, frankly, hurt you. And oh my gosh, it was a step back of going, okay, how can I prevent this in the future? How can I be predictive of who could be a osteoporotic patient and make sure I never experience this again?
Right. Yeah, that had to be traumatic for you. And
I mean, not to say
client.
it wasn't traumatic for the patient,
Yes.
but I definitely felt horrible through the whole thing.
Right. And so you did what I think you do best, and that is do some research.
I did some reading and really found out that sadly, like most of chiropractic, there isn't a lot of research. So I started drifting into the physical therapy realm, the massage therapy realm, and just straight up osteoporosis research and trying to understand how can I best care for these people and prevent me being the biggest problem that they're having.
Right. And in doing that, did you come to some conclusions about what we as potential clients can do for ourselves when looking for a chiropractor? Or maybe we've always visited one, but now we know something has changed. Is there more that we can do than just say, I have low bone density?
I think some things to look for is potentially the technique that the provider is using or making sure that they are trained in a couple different techniques, because there are gentler types of chiropractic that can still get really great results, such as maybe activator, which is a instrument that actually kind of looks like a shot without a needle, but a little bit chunkier.
Okay.
And it's a very focal impulse that doesn't require the high velocity, low amplitude thrust that has the higher risk, because it's me applying it versus the instrument that's gauged and graded. And I find for my osteoporosis patients and my other low bone density, or even my infants, that to be a very safe technique to utilize. There's also techniques such as SOT blocking. Drops can be okay. Thompson drop technique, depending upon, do they actually change the drop tension to the weight of the patient versus just slamming it down at whatever tension it's at. And I mean, the thing is there, I don't think you can necessarily find the perfect provider online unless they explicitly say, I take due diligence with osteoporosis and low bone density. Unless you find like those words, I think what you need to do is you need to have a provider that actually listens to you and your concerns, which sounds really weird. Don't they all do that? We know. Whether it be a medical provider, a physical therapist, or a chiropractor, there are times you walk in and you're like, this person gets me. And there's other times you're like, they just checked a box to make sure they got paid for this visit. You need someone that sees you as a person, that talks to you, that meets you at your goals and your needs. Meaning, what are you trying to get out of this appointment? Is it, I want to go play with my grandkids, I want to go for walks, or I'm in such excruciating pain I can't get out of bed. So what are they doing to, one, get you pain relief in their office, but also send you home with activities you can do at home to maintain that pain relief? Because here's how I look at it. I am not the hero of this story. The patient has to be the hero, meaning you need to be able to control your life. I'm just there as a guide to help you interpret what's going on, because you didn't go to medical school. You didn't go to chiropractic school. I'm there just to help you, but you ultimately need to be in control. And I think this is where it really is an integrative team. There are chiropractors that have sunk themselves into huge amounts of nutrition. I am not one of them. I refer to a nutritionist when I need to have that extra nutrition component, extra supplement component to make sure my people are getting the care they need. And then the other thing is looking at potentially maybe maybe chiropractic isn't the right person for you.
Right.
And I think that's the hardest thing, is to actually admit, you know what? I could help you. I could benefit maybe, but based off these things, you need to take care of these pieces first before I can truly benefit you or at all. And a lot of chiros, our student loan debt makes it really hard for us to own that statement of, I'm not the right fit for you.
Can you just give me an example of what that might look like when someone's not the right fit?
Yeah, so depending upon what's going on, a person that isn't necessarily going to get a lot of relief is, let's say it's a rheumatoid arthritis patient with neck pain. That is a huge no-no to adjusting. I can absolutely do the rehab and exercises, but I'm not going to adjust that neck, meaning you may not get immediate pain relief. An acupuncturist actually might be, or a massage therapist actually might be a better fit for immediate pain relief than a chiropractor who's just going to be prescribing home exercises because of the underlying contraindication to adjusting.
Right. Okay. So that brings up another possible contraindication. I know that a lot of people with scoliosis see chiropractors religiously in order to help them not fall into their curves. What if you have a relationship with a chiropractor and then you find out you have scoliosis, you have a relationship with a chiropractor, you really feel like this is a part of your life that makes your quality of life better? What do you suggest then if you find out you have low bone density?
So immediately let your provider know. Let them know. I'm not going to say that, hey, if this has been working for you, this has been keeping you moving, that's phenomenal. I don't want to take that away. I don't want you to be fearful, but you need to let the provider know, so maybe they will modify what they're doing, or maybe they're already using a low force technique, so they don't have to make any modifications for what's going on. The worst thing is just to say nothing and to let things be how they are, because that's how you end up with people like me who have caused someone harm because they didn't know that they shouldn't be doing that technique on them.
Right.
Now, when it comes to, there are times that we need to have regular care and we need to be seen regularly. I personally manage my migraines. I do have patients with scoliosis that manage some of their symptoms to remain active. But what else are you being given at home? If you're having to see your chiropractor 3 times a week, every week, I'm going to say, honestly, that's too much. When I have a maintenance patient, as I call them, my recovery, my maintainers, I'm usually seeing them once a month to once every other month because they have skills and drills to do at home to manage their pain and recovery. So this shouldn't be like a 3 times a week, weekly thing that you're having to go through. But again, I don't know your body. I don't know what exactly is going on. I don't know what your provider, but based on the research, based on what I've seen that is best, it is better to do home exercises. And then basically I'm there for when you do something I would call fun, some would say dumb, activity where you get hurt. Like maybe you decided to go climb Kilimanjaro and you fell. Okay, cool. That's when you come in. We do some aggressive acute care to get you back to your everyday baseline, back to the activities you love. And then you have skills and drills to maintain so that I can just check in and be like, hey, are we holding up? Cool. Awesome. Have a great day.
Okay. So skills and drills. So it's really fascinating because there's an overlap with how I look at the work that I do in, for instance, Short and Sweet with Sarah. It seems like, and it was designed to be the building process before you lift weights for someone who might not be ready to do that. But I've had a lot of clients who have used it to go back in and analyze how they do their lifting of weights or their HIIT workout or whatever it is. And in a sense, an actively aging population, skills and drills, or your checklist of your maintenance activities, it's really pretty much, it's like brushing your teeth. It's stuff that doesn't go away. You don't actually graduate, in my opinion, and you don't need to graduate. It's that you've refined and you hone in on the skills and drills or maintenance activities that you need. So you might change from a beginner maintenance activity to a more advanced one. And is it similar in your world?
Exactly.
Yeah.
Exactly. People ask, okay, I have this low back pain. When do I stop doing my exercises? When do I stop doing this activity? And it's like, never. Because the thing is that I love what physics and Sir Isaac Newton said. Objects in motion remain in motion. Our body is an object and we need to treat it as such. So when we get onto a lay down, do nothing, rest, don't work out, don't exercise, this becomes a problem that doesn't allow us to actually recover and heal and keep in motion. So yes, back pain doesn't go away. We just learn ways to manage it, keep it at like a 0, so not having pain. But if we stop doing those activities, it will come back, and it will come back with a vengeance.
Yes.
I'm just one of my furry children.
I saw the ear.
Sorry.
No, that's okay. I love animals, so we're all good. So, it's all kind of similar. It's that you are licensed to help people with acute care, which is not something I do. So that was why I was so fascinated by your emergency procedures. Yeah. Tell us about that, because this does happen to people with osteoporosis as well. And one of the frightening things for us, we might tire out our upper back with some repetitive gardening, for instance, and feel pain. And then the brain starts swirling and says, oh my God, I might have broken something because I feel pain. So I'm just curious what happens with emergencies for chiropractors.
So yeah, it really kind of depends upon the spectrum. And I've had some interesting cases that I've had to deal with. So beyond just being a chiropractor, I'm also a licensed emergency medical technician. So I'm an EMT. And I do teach emergency practices in a clinic, but I also use my EMT outside my practice, and I cover high school and semi-pro sidelines and make sure the athletes remain safe while they're on the sidelines. But when it comes to in-office emergencies, I would say that rib fracture would quantify one of those emergencies, because there are a number of things underneath the rib, heart, lung, blood vessels, that if they get injured and damaged, it can go from it's a rib fracture to, oh God, it's a pneumothorax with a rib fracture. Oh my gosh. Just really scary things. But for teaching what I teach my students, it's recognizing the fact that there can be things that look like neuromusculoskeletal problems that we would treat, such as patient comes in with left shoulder pain. They're also a little sweaty and feeling kind of nauseous. Is it left shoulder pain, or is it a heart attack?
Right.
Or, hey, I have a patient coming in describing the worst headache of their life, and it started about 30 minutes ago, and their face is drooping now.
Oh.
is this a neck problem and a headache, or are they having a stroke? So it's looking at all the potential things that might come to a chiropractic office, because we as doctors, or at least how I train my students, is we want to build a relationship with our patients of trust, and that they understand we have their best interests, which sometimes means they come to us. And I look at them and I go, why are you in my chiropractic clinic and not in the emergency room? What are you doing here?
So it sounds like they're pretty lucky that you're an EMT.
Well, because of things that I've dealt with on sidelines, I wouldn't feel comfortable working with my athletes in that way without having my EMT. A lot of chiropractors have multi-licenses, whether it be an EMT or a athletic training license or a massage therapy. It all just kind of depends upon how they want to practice. But all chiropractors, if they are licensed in the United States, are required to take some form of emergency care class that basically gets their toes wet in understanding and looking for these, what we would again call contraindications to chiropractic care.
So, this is really illuminating. I've never actually been to a chiropractor, but it gives me a lot of food for thought that I might look for a multi-licensed chiropractor if I'm going to go and see one. Just because it gives me more opportunities for care in a way. Because as you pointed out, if someone is an adjusting chiropractor without, let's say, a massage therapy background, then their care of me when I say, you know what, I don't really want adjusting because of my osteoporosis, the question sort of becomes, what are they going to do for me? Give me some exercises, I guess. Yeah.
Yep. And there are some soft tissue techniques that chiropractors utilize. I utilize some Graston techniques. I also use instrument assisted soft tissue mobilization, which is the generic form of Graston. I also am certified in active release technique, which is a soft tissue technique. So there are a number of ways that chiropractors can take time after graduation to move beyond just adjusting. And in my opinion, those that have taken the time to bring more active exercise, rehabilitative pieces to their practice, it's better for the patient. It's better for you that you're not just coming in, getting cracked, and that's the only thing that's giving you relief, because that makes you reliant. That makes the chiropractor the hero. And again, when it comes to your health, your wellness, your lively well-being, you need to be the hero.
Yes, that's an excellent point. Excellent point. And it is interesting, something that I have talked about before is if there isn't an end game to someone you're seeing, if there isn't a goal, then you have to really question the intent of the process that you're going through. There really needs to be a goal. And even though we both talk about skills and drills or maintenance activities, there is still a goal to progress. We are never taking our eye off the goal, and we do look for progression. Logical, step by step, can be very, very small, 10% at a time, but we're progressing and we have a goal.
And it has to be your goal, not the doctor's goal for what you need. Meaning, one of my questions is, hey, what do you want to do? For a lot of my people, it's get back on the field. It's run a little faster, hit a little harder, lift a little heavier. That's a goal. And that's what I'm going to work with them on, getting them to that piece, because sometimes it's not pain that brings you to the chiropractor. It's, I want to do this activity and I can't do it right now. I want to me personally, I'm working towards a very, very heavy lifting goal. I'm trying to get into the 1,000-pound club.
Oh, good
I
Lord.
want my bench press, my squat, and my deadlift to add together and equal 1,000 pounds. And I'm at about 650 right now for that goal.
Okay.
So I'm utilizing my fellow chiropractors so I have my own personal chiropractor that I work with to help me recover between the lifting days, help work on my form, my range of motion to make sure that I can get into the positions I need to
Right.
support that weight.
Right. And that brings up a really interesting point, because one of the things that can be quite the nemesis for many of my clients, well, I think of two major things. One is lack of range of motion at the shoulders, and we have a lot of work that I do that helps them with that. And the same thing is true with hip hinging being a big nemesis, because people will end up moving their spine rather than hinging at the hip and not realizing that's what's happening. And sometimes when all of my tricks of the trade and video yourself, this is what I see, why don't you try to see if you can see it by videoing yourself, when those don't work, I frequently say, I think you need to see someone in person. And it sounds like it doesn't have to be, oh, I need my neck adjusted, and not I need my back adjusted. Just a chiropractor could be somebody other than a physical therapist who might help you, for instance, perfect your hip hinge.
Absolutely.
And I hadn't thought of that before.
A lot of times, especially within the sports chiropractic realm, you can't tell the difference between a physical therapist and a chiropractor.
Okay.
Except accessibility. You don't need a referral to see a chiropractor.
Mm-hmm.
But there are times you go into a chiropractic office and all they do is adjust, because that's what that doc has decided is what's best for their practice.
Right.
You have to find the mobility specialist. You need to find a movement. So again, my sports chiropractors, and I typically recommend finding someone with actual certification, not just someone saying they're a sports chiropractor. So that would be the letters after their name: CCSP, Certified Chiropractic Sports Specialist, or Chiropractic Sports Practitioner, there it is, or ICSC, Internationally Certified Sports Chiropractor. Oh, God.
Okay.
The alphabet soup of doom, or a CSCS, Certified Strength and Conditioning Specialist. I don't expect anybody to remember these, but
we'll put them in the show notes.
It's looking for people that have taken the time to really emphasize movement. And they'll have it on their website. They will have pictures of rehab. They will have movement-based activities, not just you laying there and getting a massage or getting ultrasound or getting stim. They'll show pictures of people up and doing activities and being involved in their care. And then the other thing you can sometimes look for is SFMA, which SFMA is a movement assessment that is used by chiropractors, physical therapists, certified personal trainers to kind of look and see how people move. And those are going to be people that can help you move better. So in my practice, how I treat people, I do what I like to call a rehab to fitness program. You come in, you have a problem, I rehab you. Once we're done with the rehab, that might not be as far as you need to get to your fitness goal. So then I bring in my husband, who is a strength and conditioning coach, and I tag him in so that he can take what I've built as a foundation, and he adds all the little details that then gets you the finalized product that gets you back to your activity.
That's great. And what I really like is the fact that you've sort of opened up new possibilities, because I think frequently, if we are over 50 and we aren't professional or even amateur athletes on any teams, maybe a tennis team or a golf team, but for the most part, we don't really think of ourselves as athletes, but we are, because we're doing something athletic. If we want to improve our muscle and bone strength, we are performing athletics.
Exactly. I mean, this is a conversation I have with my mother week in and week out about how we're going to be more active, keep her active so she can keep doing cross-country skiing, she can keep biking, she can keep walking and hiking through the woods and doing all the activities she wants and doing them safely.
Yes.
So it is something that I work with her, and she'll come in and we'll do deep dives into weight training and exercise. And she's like, Melissa, I don't need this. Mother, yes, you do. And it is hard sometimes. This is why they tell us not to treat our family. But she also will go, but you know what's best, and you've given me the most pain relief. You've helped me the most. So I'll just shush and listen this time.
Sounds pretty darn good to me. Well,
but yes, we have to move. We have to lift weights.
Yes, we do. And I think you and I both agree there. Yeah. Well, I hope that my listeners have found out some new things about questions they can ask chiropractors. I know you've really opened up my eyes. I now see how much easier it might be. My insurance pays for a certain number of chiropractic visits. I can do the investigation myself, make the appointments myself. I don't really have doors closed. It's pretty wide open, and I can investigate and find someone who works with the kind of movements and things that I'd be interested in. So that's fabulous. I really like that.
And if any of the listeners have questions or need help, please feel free to reach out. I am happy to share resources to find you a provider in your area. Granted, if you're in the Twin Cities, just come see me.
That's right. So Melissa is going to be sharing her communication preferences. I have a feeling it might be an email, but you never know. Okay.
Email is easiest, macperformance.clinic@gmail.com, or you can find me on Instagram at macp_clinic and can message me there. Either one is super easy to get a hold of me through to find out what's going on. And again, I just want people to get better. I just want to see people keep moving, because a lot of times most of our chronic long-term health complaints can be helped with simply getting out the door and getting some movement in our life.
Yes, it's so true. Well, that brings me to the very last thing I wanted to have you mention. You have a podcast of your own.
I do. That is the Mac Performance Podcast. It is a comprehensive health and wellness podcast that will whiplash you back into health as we jump from topic to topic each week. And better tune in this week so that you can hear Sarah's episode on my podcast.
That's right. All right. Well, I thank you so much. You've given me food for thought, so I know you've given my listeners a lot of food for thought, and so nice of you to be open to communication with us.
Thank you. Thank you for having me and giving this opportunity to share.
All right. Thanks so much. Thank you for listening to the Bone Bootcamp podcast. I hope you enjoyed this episode. If you're loving the podcast, please subscribe. Also, share with a friend. I would really appreciate it. And if you're inspired, a really helpful thing to do is leave a review on iTunes or Spotify. Thank you again for joining me. See you in the next episode.